As families gather for the holidays, we often have the chance to spend extended quality time with aging parents, grandparents, and relatives we may not see every day. Now, these moments can bring a lot of joy, but they can also reveal subtle changes in memory, behavior, or communication that may go unnoticed throughout the year. Dr. Audrey Sanders is a neurologist and interim medical director of Trinity Health's Memory Disorders Program in West Michigan. So let's talk about these early signs of Alzheimer's and how we might notice these when we see our family this holiday season.
Yeah, absolutely. So when we get together with families, and sometimes it can be an overwhelming situation if we have a lot of family together. So sometimes the first signs that someone may notice is that a family member is more withdrawn, that they're not kind of able to comprehend or follow conversations that are happening amongst many family members, or they're starting to repeat conversations throughout the get-together, or they're not remembering details or even the names of familiar people that are in the room with them. So those would be things that I'd be worried about if it was my family member, and things for family members to also be kind of cognizant of, that there might be something more going on here.
Okay, so say that's happening during your holiday get-together. What do you do?
Yeah, so it can be tough because certainly if we have memory loss, sometimes the family member themselves is not recognizing this. So coming at them from a non-aggressive approach, a point of love and concern, to just kind of say, hey, mom or dad, I'm noticing some concerns. We should maybe get some further help. And so kind of having that conversation with them. So then the next step would be touching base with the primary care provider to say, do we need another evaluation? Maybe something else is going on, like a medication that's causing a side effect, or a sleep problem, or depression. Sometimes it's other things that can mimic dementia, but certainly getting that initial evaluation would be my first recommendation to start with.
Okay, and then talk to us about why early detection is so important, having these conversations now versus waiting.
Absolutely. So it allows family and patients to develop a plan. So that could be a plan where we can intervene with early intervention. And we do have some newer treatments for Alzheimer's specifically that showed benefit in the earliest stages. So it could be from developing a treatment plan, as well as allowing families and patients to develop kind of a safety plan. Is mom and dad, are they safe in their home anymore? Do we need to discuss about having in-home help or other things to try to support them? Can also help us recognize other symptoms that can come with dementia, such as behavioral disturbance or sleep disturbance, and how do we help them navigate those things? And specific to like Trinity Health, we try to have a multidisciplinary approach with not only treatment plans, but also helping to support the family with support groups and such.
Wonderful. So make these decisions early. And you want more information, trinityhealthmichigan.org/memory.